Corinne and I were big advocates for pharmacists being involved here in the state of California since, I want to say, about 2013. And so can you talk about how you got into this role? Because you worked for a big brand chain, Walgreens, for a few years. Can you talk about the mindset of being in pharmacy school? Did they ever discuss Schedule I cannabis or Schedule I drugs like cannabis? And did you ever think that you'd be in the business dispensing after being in the block stores like Walgreens?
Yeah, well, John, thank you for having me. I appreciate it. I think this is a great topic to talk about, and I think that pharmacists in this industry are integral parts. For myself, I spent 16 years with Walgreens working in retail pharmacy. As most pharmacists do, you go to school thinking that you're going to help patients, you're going to improve their quality of life, and make sure they're taking the right medications at the right doses and everything. And as many people can respect and understand, their experiences at a retail pharmacy are a little bit different than that. And that's where I think a lot of retail pharmacists have gotten just disenfranchised with it. You spend more of your time arguing with doctors and insurance companies, about what's covered, what isn't, and why. Then, you have patients that are upset about why it costs so much, why it's taking so long. You're hearing from, your corporate bosses so that you're losing hours and expecting to do more. And those patients that do have questions, that you're there to help, help guide with their concerns, their side effects, you don't have the time to have that conversation with them. And after a process like that, they're probably not that interested in hearing what you have to say anyway, with all the frustration and everything. So it really got away from helping patients and really having that be the goal of the process. And when they started the medical marijuana program in Connecticut, for me, I was pretty excited. I mean, they never taught us anything about it in college other than, whatever recreational usage you might have had. I believe there was some discussion in our toxicology class, which I find rather amusing at this point and ironic, but there wasn't any discussion of the endocannabinoid system or any of those kind of things. And, my desire to leave pharmacy and have actual patient contact and outcome effect was my biggest driver, more so than my knowledge of the endocannabinoid system or anything like that.
Hi, John Malanca here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at Patients Group and on Facebook at United Patients Group, as well as for our podcast. Please click the link in the description below. We'll see you there. Bye-bye.